Welcome to Health Systems CIO's interview with Sanjeev Sah, VP and Chief Information Security Officer with Centura Health. I'm Anthony Guerra, founder and editor-in-chief. Sanjeev, thanks for joining me.
Anthony, thank you so much for having me. I'm just thrilled to be in a conversation with you today.
Very good. Looking forward to it. Do you want to tell me a little bit about your organization and your role?
Yeah, so I serve as Vice President and Chief Information Security Officer for Centura Health. Centura Health is a organization that is a prominent healthcare provider in Colorado
Hmm.
and regional areas with 17 hospitals, 14 affiliated hospital locations, health neighborhoods, health at home, urgent care centers, emergency rooms. So 100 plus physician practices, our 21,000 plus people, care providers, care for the communities that we serve in.
Yeah, 17 hospitals, definitely a sizable organization. So I see you've been there for about 8 months. So um, I'm interested in learning a little bit about your career journey, just the points that you want to articulate. I like to see how people wind up where they are. Sometimes CISOs have different types of backgrounds. So how did you wind up getting to security and then getting into healthcare security? And then ultimately, if you want to talk a little bit about selecting this role.
So Anthony, so let me walk you quickly through a bit of my background. So I started in automotive field when I first started my professional career. I worked for a global supplier that was located in 65 countries. For them, I started as a junior IT professional. Ultimately, over a 10-year period, worked in corporate offices, worked at and contributed at a plant location, as well as coming back to the corporate office as the head of security for the organization. And as I played that role, I learned a lot. Many people contributed to career and success that I have had in that journey, and and it really helps shape my path into the future. With an advice from my former CIO, Mr. Mario Leone, I went on a journey to learn a bit more about different sectors and contribute from a place of my knowledge and skill while partnering with people and partners in those organizations. It took me to a healthcare organization, Home Health and Hospice in Baton Rouge, Louisiana. That was my first time being in healthcare as the first time CISO for that organization. I have to tell you, I learned so much and made, with working with people, really to make a significant difference for the organization from security and compliance perspective. And then an opportunity presented at University of North Carolina at Charlotte to serve again as the first time CISO. So if that's becoming a trend, I served as first time CISO for next couple of organizations in healthcare, ultimately at Texas Children's Hospital in Houston as well. Again, a fantastic organization, a tremendous learning ground, and ability to contribute in many ways for patients' well-being, working to enhance clinicians' experience as well as their efficiency, and really leveraging cyber as innovation to drive technology innovation that really enhances patient experience and patient outcomes. When I was at Texas Children's, it presented me with an opportunity to serve as a CIO at a organization that was dental and vision insurance in Baton Rouge, Louisiana. And from there, I went on to Medical University of South Carolina to serve again in the same role as a Chief Information Security Officer. Being at an academic medical center, it had its own unique opportunities and challenges. But one thing that was common across all of my journey, either through automotive and through healthcare, was that the difference that could be made was done with people and through partnership, leveraging technology not simply as a technology component, but using that as an innovation to deliver patient experience, patient outcomes, and enhance really clinicians' ability to care for patients that we served. And that then brings me to Centura Health. What a fantastic opportunity to do that for a system that cares for a large population and network of people in this part of the country.
Why do you think healthcare so far has held you? Why did it stick, so to speak? I mean, you went from automotive to healthcare. You could have easily bounced back to automotive or to anything else, finance, retail. But it seems like healthcare has held you, and I don't know if it will forever, but it has for quite some time. Sometimes we just develop an expertise, and therefore we're recruited to those roles because that's what we do. It's what we know. Would you say that it has held you? That something about the industry attracts you perhaps more than others?
Yeah, so being able to serve with the mission that you have in a given organization is really why we come together as professionals, and that mission is just heightened when you are able to use your talent and
Mhm.
work with others in the organization, particularly at Centura Health, where we're very mission oriented in doing what's best for our people that we serve and for each other within the organization. Really, it's hard to find a mission that really touches your mind, heart, and the kind of satisfaction you get by providing care for people, but then again, making lives better ultimately. I'll have to you share an example with
Hmm.
you. Along the journey within healthcare several years ago, I found my own child in emergency room and recognized the fact that many clinicians came to her aid, and multiple sets of technologies, either they were biomedical devices or a wirelessly connected asset within the ER or monitoring center where her vitals were being monitored. It gave me a real personal example of how our work, not my work, our work comes together to really provide for her care. And I was praying and hopeful that all of it worked really well
Mm.
for my daughter. She's perfectly fine today, a beautiful 6 year old. But when that happened to her at 1 year of age, it really, really grounded me as a healthcare professional. And today I'm much more centered around our mission and our purpose, and bringing not just cyber, but technology and our skills through partnerships with all stakeholders to do what is best for our patients every single time. Ultimately, it could be your child, it could be your family member.
Right, and you could imagine that with all you were dealing with in that situation and all the stress and all that the clinicians are doing to try and care for your child, you can just imagine them trying to do that while transitioning to paper because there's some ransomware attack. And you say, I don't ever want to have that happen where I'm working, if possible. I mean, none of the CISOs who this happens to are bad people, right? They're all doing their best work, but you want to try and prevent it, right? Because you've been in that situation, and we know how devastating that could be.
Absolutely, absolutely. You know, as we are mission and patient focused, really our security focus must be on protecting our people, data and technology, ultimately also sustaining, enabling, and transforming our organization's capabilities. And ransomware or event that is, you know, can be very negative for a given organization who is impacted by it. We ultimately, we're all working hard to provide assurance for disaster recovery
Mhm.
and business continuity with cyber safeguards and controls, making sure that we have appropriate disaster recovery plans, making sure that we have tested them, and so on. So you make a really important point, Anthony. Safeguarding our organization's operations today in this current uh, um, industry where threat is ever evolving really becomes our number one priority.
So when you interview somewhere, and you could share as much of this as you want, but a lot of times people are recruited. There's the high level, executive recruiters. We know there's a few companies. People get recruited. Somebody comes to you perhaps and says, "Hey, there's this opportunity." So, what do you want to know as a CISO about what's going on at that place to help you evaluate it? I mean, or is it just blind? Do you come in, and then you say, okay, now let me take a look? Or do you say, well, I want to know what they have in place because I want to know what I'm getting into. I don't want to start day one and oh my God, this is not, this is a big problem. We're going to get breached any minute. So I'm just wondering from a CISO point of view, is that something that security people want to do maybe even more than CIOs? Because again, jumping into a non-optimal situation is even more dangerous for a CISO. Does that make any sense?
Yeah, but I think I might take your question and just maybe internalize that and share my
Please.
mindset, how I approach the role
Yeah.
and how I collaborate with others. For me, mission in healthcare is the number one opportunity, as a CISO. On top of that, any opportunity that gives us ability to, develop a program, implement it, manage it, to safeguard again operations, sustaining our organization's capabilities to not just provide care but also enhance outcomes. To me, combination of all of that really drives the type of opportunities I like to go after.
Hmm.
Um, and so, at Centura Health, I'm presented with a fantastic opportunity to do exactly that.
Hmm.
And and I don't believe our roles with other leaders within the organization or stakeholders are at conflict at all. We all work together to really provide for care and then do what's best for the organization. So, for example, I'm in extremely close partnership with my CIO and a governing enterprise information security executive committee, as well as I report to the board of trustees, audit and compliance committees. And so, in doing that, we are able to develop a strategy that's right for my organization. We're able to develop tactical plans with the necessary buy-in and support that's really important for us to go ahead and advance the security posture, improve maturity, but again, like importantly, safeguard operations for our organization. So for me, I don't see any more fantastic opportunity than being able to do that, where my work, your work, our work together enhances care for our patients and for our families.
Absolutely. Absolutely. Now, I'm not saying you're facing this situation, but I'm guessing that two areas that can be difficult for CISOs would be one, if they can't get the funding that they need to do the things they feel they need to do. And number two would be if they're not getting the support from executive leadership, meaning whenever there's pushback against from users about security measures, that the leadership takes the side of those pushing back. And so therefore the security professional cannot get the things done that they feel they need to get done. Again, I'm not saying you're dealing with those things. You may have a beautiful situation. It sounds like you do, but I'm guessing that there are some folks out there that are dealing with either of those. Do you think those are two of the main potential points of frustration for CISOs? And how would you deal with them for someone who's facing them?
Yes, I think the question is a very important one. But I think there's a way to approach the role, and there's a way to approach governance for security that can lend itself to success versus the type of challenges that one can face. And there are real challenges for many organizations where resources have to be prioritized in a way that suits best for the organization. So maybe what I'll share with you is the approach that I take in successfully leading such programs, and
Hmm.
hopefully that information is valuable to our audience, your audience. So first and foremost, I believe that CISO has to approach the role with courage, and courage means that what is right thing to do for the organization is the right thing to do for the organization. And in doing so, we ought to be extremely professional, balanced, but methodical about approaching what we need to be able to do for the organization to safeguard again operations and do what's best for our patients and families. And so I take that approach, and I have taken that approach multiple times, if that was at Texas Children's Hospital or Medical University of South Carolina, and today at Centura Health. I've been in the last 6 to 8 months building a coalition, garnering support for what is our cyber strategy, and to then develop tactical plans that are coordinated well with IT effort as well as organizational strategic goals that we have. And I'm pleased to report that stakeholders at Centura Health have been extremely supportive in that journey, and are really appreciative of, I'm really appreciative of their partnership in making sure the right type of balance is provided to both the strategy and the tactical plans to then successfully implement and manage that. So that's the advice that I would provide, is partner closely with your CIO, partner closely with all important stakeholders, and that's legal, that's compliance, and that's the executive team, as well as your IT stakeholders, to really gain their insight and their support in the plan that we build. And so really that's been path to success for the opportunities that I've had to develop a plan and implement that for a variety of organizations.
So if someone is experiencing frustration in their efforts to move things forward, it sounds like you're saying take a look at yourself first and make sure you're operating in the right way to get buy-in ahead of the game. Because if you're running into a lot of challenges and a lot of friction, it might be you. It might be the way you're approaching things. Is that correct?
I think it's a combination of things, right? As we approach a topic and looking for support, we definitely have to be business centric. We have to be balanced in our approach, right? Sometimes the work that we want to do, which may be number one priority for cyber, but it may not be feasible from implementation perspective, and so we should be balanced in our approach. That's definitely a piece of advice that I would offer. The second to that is really making sure that stakeholders are brought on the journey with the CISO to not just have the strategy and tactical plans, but have the appropriate buy-in and support to really be successful at that. And lastly, we will have challenges. New priorities will come up, but we have to address them professionally and head on during potentially implementation, as we learn that, look, we can't exactly do what we planned for, but if we modify, we can still achieve 85% of the goal that we had intended, that might be good enough,
Hmm.
because it's a balanced approach. And so I would advise that we really take a balanced approach where people are brought onto the journey and execute on cyber plans in a way that's sustainable and feasible for the organization.
Do you think that a large part of the CISO role is not green lighting or stopping things, but it's explaining the trade-offs and the risk to those who are going to make that decision, whether it's the CIO, the CEO, or the board? So you're not saying, no, we're not doing this. You're saying, hey, here's the risk. Here's the risk level now. Here's the risk level if we do this. Here's the risk level if we spend this money. It goes down or it goes up or whatever. Is that how you would describe a large part of the role?
I think our role is multi-pronged, right? In the scenario that you just described, we serve as an advisor from a risk perspective to stakeholders in one way. We are also strategists, right? That develop strategic plans and then helps achieve those goals and outcomes, both from business perspective and then from cyber perspective. We are also tacticians who then uh, help guide how we go about implementing safeguards and controls that improves the security posture. And lastly, we are collaborators in terms of ensuring that people who need to be part of your journey, part of the team, understand intended security goals and approaches so that they are part of the team who help then execute on the plan. So I view a CISO role in all of those ways, and depending on circumstances, forums, or need, uh, one flexes in one way or the other to help achieve the ultimate goal, which is again, sorry for repeating it, but really to enhance security posture so that operations can be safeguarded, our patients can be served with the best possible capabilities enabled by technology, and then better outcomes are achieved.
Do you want to talk about either the one, two, or three? It's up to you. Things that you're focused on, working on, big picture stuff, where your priorities are right now.
Yeah, so we are really prioritizing across multiple initiatives. We are working to ensure that governance, risk, and compliance aspects are appropriately addressed for our organization. We are enhancing our ability or capabilities on identity access and providing for trust equation of that. We are enhancing capabilities with infrastructure and cloud security. As you know, threats are always evolving, so we need to continue to evolve our safeguards and controls. Threat and vulnerability with appropriate security operations center perspective, which is more of a co-managed approach to bring capabilities quickly to our organization. So that's the other priority we have. And then I think we should always have the priority of making sure we have the talent that's always has the right set of skills and knowledge, that we are providing appropriate education and training to our people and to our partners. So those are really our top priorities, and there are multiple actions that we take within them to enhance security posture and maturity.
You mentioned personnel. Do you feel there's a lack of people for the positions and the talents and the qualifications that you need to run a shop of your size, a security shop of your size?
I think the reality of the global cyber um, um, cyber posture is that uh, cyber professionals are high in demand,
Hmm.
and especially in local markets, it's competition is strong, and professionals that are needed, not necessarily enough or sufficient numbers. So I think the best way to to approach the skills gap is really find partnerships that work well, have can bring the type of skills and resources quickly to assist. And so we approach that strategically with partnerships that gives us the best possible way to close the skills gap or the talent gap. And so that's the approach that we take.
You're talking about using consultants, a short-term type of thing, coming in and
I'm talking about strategic partnerships like even for security monitoring, right? So we have in-house resources
Mhm,
that take the actions that we need to take, but then we also rely on third party to
mhm,
really look at all of the threats that our organization would face from cyber perspective. But
right.
our team then zeroes in and takes the local action that we need to take. So that being an example of it, strategic partnership that are both short term and long term to give us the quickest opportunity to have the best talent that we need to have to really execute on the plans that we have for our organization.
What's your best advice to aspiring CISOs, wherever they are in their career journey? What would your advice be to them for what it takes to get to that ultimate role?
Well, I think as I offer this advice, I'm mindful that I'm as much of a learner from the community of CISOs and other professionals, and so I'll offer my advice with that baseline. Really, we as CISOs must be business centric in that cyber, is definitely something that's extremely important to all of our organizations, particularly in healthcare. People have a much better understanding of cyber threats in the marketplace today, and so using that as a leverage to really build the kind of a stakeholder buy-in and support that is needed to advance cybersecurity, I would say that ought to be the number one component of the CISO role. Additionally, really having a strategic view, but in addition, making sure that we also have tactical strength to go with that, because in all plans are good, but sometimes they can run into implementation challenges. For example, a network segmentation is an approach that many organizations take to protect the organization, being an example, but extremely hard to implement. And it's in close partnership with infrastructure teams and network teams to be able to do that. And then always keeping the mind and eyes open to learn from the community in terms of what others are doing to provide for better security posture and improve maturity from cyber perspective. So that would be the third element. And maybe the fourth element of all this is really engaging with the community at large, both from sharing your knowledge and experience, but at the same time learning from others. And as an example, I do that by participating through hymns or other avenues that are
Mhm.
presented to me, or a conversation that we're having today.
I would imagine that one of the most important relationships a CISO has is with the CIO. Do you have any advice on how to have a productive, successful relationship with the CIO?
Yes, absolutely. I think, and I imagine CIO being the manager for the CISO
Right,
in this question.
right.
Um, Look, CIO CIOs are really charged with tremendous accountability and responsibility from operations perspective. And I think a CISO really needs to appreciate and understand that and be helpful in really helping achieve the overall objective of why we exist as a technology organization. and security is a very important component of it. So I take the approach that I work extremely closely with all of my IT stakeholder leaders, but particularly with my CIO. I'm ready to help answer any questions, help advocate for security in a variety of different forums. And in fact, we partner with each other to advance that conversation with the executive teams or with or with the board of trustees. To me, I have found my senior vice president and chief information officer, Ms. Carrie Damon, one that is extremely supportive, very understanding of what we're trying to achieve from cyber perspective, and has lent appropriate support to really advance the program goals that we have. And to be frank with you, I don't think we would be there in terms of cyber program or plan, in terms of stakeholder buy-in, without the kind of relationship and kind of advocacy and support that we have from my CIO. And my advice would be for every CISO, I don't think it's a necessarily a place of finding a conflict. If anything, it's a place that we ought to find the most balanced perspective. I should go on to say that it's not going to be without professional discussion or debates at times, but really we ought to keep in mind that ultimately why we exist as an IT organization is to really support the operations and safeguard operations.
All right, well, Sanjeev, that's about all we had time for today. Is there anything else you want to add before I let you go?
Well, Anthony, thank you so much for the opportunity to share my thoughts. Again, it's a fantastic opportunity to serve in my role at my organization. And I just appreciate the fact that I have had an opportunity to share my experience with you today.
Well, thank you so much. You have a wonderful day, Sanjeev.
Thank you so much, Anthony.